Here is something I need you to sit with for just a moment before we begin. Right now, at this very second, your kidneys are quietly filtering everything in your bloodstream. Every medication you took this morning, every supplement, every painkiller, every pill you trust to keep you healthy and moving and living your life. And here is what almost nobody takes the time to tell people over 60. Some of those medications are not neutral passengers in your body. They are putting real pressure on kidneys that are already working harder than they used to. That is what we are talking about today. 5 specific medications, some of them possibly sitting in your medicine cabinet right now, that research has shown can quietly harm kidney function in adults over 60. And 3 things you can bring to your very next doctor's appointment that could genuinely change the direction of your health. But before I give you that list, I need to make sure you understand why these medications affect you differently than they would have 10 or 20 years ago. Because that understanding is what will actually protect you, not just a list of pill names. I'm Dr. Grace Wells. I've spent over 15 years working specifically with older adults on kidney health and diabetes. And the reason I'm making this video is not to frighten you. It's because I keep having the same conversation over and over with patients and with families who reach out online, people who are doing everything right, taking every pill faithfully, showing up to every appointment, trusting the system completely. And somehow, their kidneys were still declining. Not from disease, not from bad choices, from medications. Medications that were absolutely appropriate at 45 that became quietly dangerous at 65 without anyone stopping to revisit that question. I am not here to tell you your doctor is wrong. Most physicians are doing their very best with limited time and enormous patient loads. But there is a gap, a real documented gap, between what gets written on a prescription pad and what gets explained about how that medication interacts with an aging kidney. Today, I want to close that gap for you, and right now, while I'm still talking, leave a comment below and tell me how many medications you are currently taking. Just a number, that's it. Because in a few minutes, that number is going to mean something very specific. Before we get to the 5 medications, there is one piece of biology I need you to understand. Because once you understand this, everything else will make sense. After the age of 40, your kidney filtration rate, doctors call it GFR, declines by roughly 1% every single year. Not because something is wrong with you, not because you made a mistake, just because that is what time does to a kidney. By the time you are 65, most adults have already lost 25 to 30% of their peak filtering capacity. And here's the part that surprises people every single time I explain it. You feel nothing, no pain, no warning signal, no symptom that something is quietly shifting. The kidneys have enormous built-in reserve, and they will compensate for years before anything shows up in how you feel. So imagine this. Your kidney function is like a water tank. When you were younger, the tank was full. As the years pass, the tank slowly gets smaller, not broken, just smaller. That is normal aging. Now add medications that put extra pressure on that tank every single day. When the tank was full, there was plenty of room to absorb that pressure. But at 70% capacity, that same daily pressure lands very differently. The National Kidney Foundation has documented this extensively. And what research published in JAMA Internal Medicine has shown repeatedly is that medications proven safe in younger adults were often never tested in people who had already lost a meaningful portion of their filtering capacity. That is the gap. That is why age changes the equation. And that is why what was safe for you at 48 deserves a second look at 68. I want to tell you about Margaret. Margaret was 69 years old, a retired nurse from North Carolina, 32 years in pediatrics. If anyone knew how to be a careful, attentive patient, it was Margaret. When she retired, her knees finally caught up with her. Years of long shifts, long hallways, long days on her feet. Her primary care doctor prescribed ibuprofen for the flare-ups. Completely reasonable. She was also on lisinopril, an ACE inhibitor for blood pressure she had been managing for 6 years without a problem. Margaret did what good patients do. She took everything exactly as directed, never missed a dose, never self-medicated beyond what was prescribed. She showed up to every appointment. About 9 months into this routine, she started noticing things. A heaviness in her legs by evening. A fatigue that a full night's sleep did not fix. A mental fog she kept dismissing as just getting older. It wasn't just getting older. Her routine blood work told a different story. Her creatinine was elevated. Her GFR had dropped significantly enough that her doctor referred her immediately to a nephrologist. Margaret sat in that specialist's office and asked the question I hear so often it genuinely breaks my heart. I did everything exactly right. How did this happen? Her nephrologist explained it carefully. The ibuprofen she was taking regularly was constricting the blood vessels that supply blood to her kidneys. The lisinopril, which relaxes blood vessels to control pressure, was compounding that effect in a very specific, very dangerous way. Together, they were creating what kidney specialists call a double hit. A double hit is when two medications, each prescribed for valid reasons, each appropriate in isolation, interact in a way that significantly increases kidney injury risk, especially in adults whose baseline kidney capacity is already reduced by age. Margaret looked at her nephrologist and said something I keep coming back to. Nobody connected these two prescriptions, different offices, different systems. Nobody was looking at the whole picture. Her kidney function stabilized after the medications were adjusted, but not entirely. There was some permanent loss, and her nephrologist said something that is the entire reason I make videos like this one. Margaret, if we had caught this 8 months earlier, we would be having a very different conversation right now. If that landed heavily, it's supposed to. Now let me take what happened to Margaret one step further, because there is a specific combination that kidney specialists consider one of the most dangerous scenarios in older adults. It's called the triple whammy. Here is what it looks like. An NSAID, that's ibuprofen or naproxen, combined with an ACE inhibitor or ARB, common blood pressure medications, combined with a diuretic, a water pill. 3 medications, each prescribed for a legitimate reason, each considered perfectly appropriate on its own, but together, research published in the New England Journal of Medicine has documented that this combination substantially increases the risk of acute kidney injury. And here is what makes this so important for you specifically. These are 3 of the most commonly prescribed medication types for adults over 60. Millions of people are taking 2 or even all 3 simultaneously, often prescribed by different specialists who do not have full visibility into what the others have prescribed. Your cardiologist sees your heart, your orthopedic doctor sees your joints, your primary care doctor sees the middle. But who is looking at all of it at once? Often, nobody, unless you ask. We will talk about exactly how to ask, but first, more stories. Because these 5 medications affect people in very different ways, and I want you to see yourself, or someone you love, in at least one of them. Before we continue, if what you have heard so far already matches something in your own life, or reminds you of someone sitting at a kitchen table, somewhere taking medications they trust completely, save this video right now, not for later, right now, because what is coming next, the 5 medications and the 3 solutions, that is what you will want to go back to before your next appointment. Save it. Then keep watching. Robert was 72, a retired high school principal from Georgia who had been on omeprazole, Prilosec, for acid reflux for nearly 7 years. His doctor renewed the prescription automatically because it worked and Robert had no complaints. What Robert did not know was that research published in the Journal of the American Society of Nephrology has linked long-term PPI use, proton pump inhibitors like omeprazole, to a kidney condition called acute interstitial nephritis. Silent inflammation inside the kidney tissue that develops without a single symptom you would ever notice. When Robert's GFR was flagged during routine blood work, he was genuinely confused. My acid reflux medication, that is what is hurting my kidneys? Once the omeprazole was replaced with an appropriate alternative, the inflammation resolved. But Robert said something afterward that I think about often. I assumed that because my doctor kept refilling it without questions, it was safe forever. I had no idea there was a difference between short-term safe and 7-year safe. That distinction, short-term safe versus long-term safe, is something you deserve to understand about every medication you take regularly. Then there is Dorothy, 65 years old. She had been taking naproxen, Aleve, every single morning for shoulder pain. It was over the counter. She bought it at the grocery store. It genuinely did not cross her mind that it needed to be mentioned to her doctor. It's just Aleve. You can get it anywhere. But the FDA labeling for naproxen includes clear kidney risk warnings for long-term daily use. Warnings that are easy to overlook when you are simply trying to get through the morning without pain. Dorothy's situation was caught early. Her doctor, during a routine visit, asked about anti-inflammatory use almost casually. Dorothy mentioned the Aleve as an afterthought. Her doctor paused. "Dorothy, how long have you been taking that every single day?" The naproxen was stopped. She switched to a topical anti-inflammatory. Her kidney function stabilized. "I thought over-the-counter meant safe for everyone all the time," she told me. That assumption almost cost me something I can never get back. And then there is a story that is not about one specific person. It is about a gap in the system that I need you to understand. Picture an older woman seeing 3 specialists, a cardiologist who prescribes a diuretic, a primary care doctor who prescribes an ACE inhibitor, an orthopedic surgeon who recommends naproxen for her joint pain. 3 doctors. 3 completely reasonable prescriptions. None of them aware of what the others have given her. She ends up in the emergency room. Severe fatigue, confusion, almost no urine output, textbook triple whammy, acute kidney crisis. She recovered because she got help quickly. A geriatrician reviewed her complete medication list and restructured everything. All 3 specialists now communicate through a shared care coordinator. She said afterward, "I thought having 3 specialists meant I was getting the most thorough possible care. I didn't understand that 3 specialists with nobody looking at the whole picture was actually a gap. That gap is preventable, and now you know to look for it. If any of these stories feel familiar, if you recognized yourself, your spouse, your parent, or someone you had lunch with last week, leave a comment below. Just write, 'This is me,' or 'I'm sharing this.' I read every comment, and when I see those words, it tells me this conversation is landing the way it's supposed to." All right, you have been patient and you understand the why behind all of this. Now let's make this count. Here are the 5 medications that research has documented as potentially harmful to kidney function in adults over 60. Number 1, NSAID's ibuprofen and naproxen. Advil, Motrin, Aleve. For short-term, occasional use in otherwise healthy adults, these are largely appropriate. But for adults over 60 taking them regularly, daily or near daily, the risk profile changes significantly. Here is what happens inside your kidneys. NSAIDs block a group of chemicals called prostaglandins. Those prostaglandins keep the blood vessels feeding your kidneys open and relaxed. When NSAIDs suppress them, those vessels constrict. Blood flow to the kidneys drops. In a younger body with full kidney reserve, the body compensates. In an adult already at 70% kidney capacity, sustained constriction causes real, cumulative damage. That risk multiplies when you are even mildly dehydrated, when you are ill, or when you are also taking blood pressure medication. The American Journal of Kidney Diseases has published extensive research documenting this relationship specifically in older adults. Number 2, proton pump inhibitors. Omeprazole, pantoprazole, esomeprazole, Prilosec, Protonix, Nexium. Short-term use, generally appropriate. The problem is long-term use, months to years, which has become the norm because these medications work well and prescriptions are often renewed without reassessment. Research in both the Journal of the American Society of Nephrology and the American Journal of Kidney Diseases has linked long-term PPI use to two distinct kidney risks: acute interstitial nephritis and increased risk of chronic kidney disease progression. If you have been on a PPI for more than a year, this is worth one specific, focused conversation with your doctor. Not to stop it abruptly, that can cause a rebound that is uncomfortable and difficult to manage, but to genuinely ask, is this still necessary? And if so, at what dose? Number 3, certain antibiotics, specifically aminoglycosides, gentamicin, tobramycin, and vancomycin. These are primarily used in hospital settings, which is why many people do not recognize the names. But I include them because a significant number of adults over 60 who have been hospitalized have received these medications without ever being told what they were. They are directly toxic to kidney cells at high concentrations, and adults with already reduced baseline kidney function are at substantially higher risk. If you have been hospitalized and received IV antibiotics in the past several years, it is entirely reasonable to ask your doctor, what antibiotics was I given? And was my kidney function monitored while I was receiving them? Number 4 is lithium. Lithium is effective for certain mood disorders and has been used reliably by many people for decades. But lithium has what doctors call a narrow therapeutic window. The difference between a helpful dose and a harmful one is smaller than almost any other medication you can name. Long-term use is associated with chronic tubular interstitial nephritis, gradual kidney tissue damage that develops without symptoms, without warning, without anything you would feel until it is already progressed. The intervention here is not necessarily stopping lithium. It is consistent, regular monitoring. Blood levels and kidney function should be tested on a defined schedule. If you or someone you love is on long-term lithium, the question to ask your doctor is very specific. How often is my kidney function being checked? And when was the last time? Number 5, contrast agents used in CT scans and imaging. If you have had a CT scan with contrast dye, a substance called iodinated contrast was injected intravenously. For most people with normal kidney function, it clears without issue. But for adults over 60, the majority of whom have some degree of reduced kidney function, contrast agents can cause what is called contrast-induced nephropathy, significant kidney stress that occurs during the filtering process itself. This risk is completely manageable when it is identified in advance. Prehydration protocols exist, lower contrast alternatives exist, but they only get applied if your kidney function is flagged before the procedure begins. So anytime you are scheduled for imaging with contrast, tell the radiology team your GFR number and ask directly, given my kidney function, what precautions will you be taking? Now, 3 solutions, not vague advice. 3 specific things you can actually act on. Solution 1, know your GFR number. GFR, glomerular filtration rate, is the most direct measure of how well your kidneys are filtering. It comes from a standard blood test. After 60, it should be checked at every annual visit at minimum. Here's how to read it. Above 60 is generally considered adequate. Between 45 and 59 means mildly reduced. Monitor more frequently and discuss with your doctor. Below 45 is a conversation with a nephrologist. If you have never been told your GFR number, call your doctor's office today. Ask for it from your most recent blood work. That number belongs to you. Once you know it, track it over time because the trend matters as much as any single reading. A note in your phone, a small card in your wallet, 3 readings with dates. That is your baseline, and it is one of the most powerful things you can carry into any medical appointment. Solution 2, the medication review conversation. Before your next appointment, gather every prescription medication, every over-the-counter product, every supplement, every vitamin. Put them in a bag or write a complete list. Set that in front of your doctor and ask 2 very specific questions. First, are any of these putting stress on my kidneys given my current kidney function? Second, given my age and my GFR, am I on the lowest effective dose for each of these? And if you see multiple specialists, ask your primary care doctor to serve as your medication coordinator, one person who is responsible for reviewing the full picture. That role does not automatically get assigned. You have to ask for it, but it is a completely reasonable ask, and most physicians will genuinely welcome it. Solution 3, safer alternatives for pain and other common needs. If you are taking daily oral NSAIDs for arthritis or joint pain, ask about topical diclofenac gel. It delivers anti-inflammatory medication directly into the joint through the skin with dramatically lower kidney exposure than any oral pill. Acetaminophen, at appropriate doses, is generally kidney safe and is significantly underused for arthritis pain management in older adults. For acid reflux, if you have been on a PPI for an extended period, ask your doctor whether an H2 blocker like famotidine might be sufficient, or whether the PPI is still necessary at its current dose. For imaging, proactively tell the radiology team your kidney function before any contrast procedure. Ask about prehydration and contrast-free alternatives. And for everyone, without exception, stay hydrated, especially when you are ill or in hot weather. Dehydration concentrates medications in your bloodstream and sharply increases the burden on your kidneys. Now let me answer the questions I know are already forming. How do I bring this up without my doctor feeling questioned? Use this language. Say, I've been learning about how certain medications can affect kidney function as we get older, and I would love your perspective on my specific situation. You are inviting their expertise. That is not a challenge. That is exactly what a productive, trusting patient-doctor relationship looks like. Most physicians will genuinely welcome a patient who took the time to come in informed. What if I've been on these medications for years and feel completely fine? Feeling fine is not the same as being fine. I say that not to alarm you, but because early kidney decline produces no symptoms. That is simply the nature of how kidneys compensate. They work quietly until the reserve is gone. Get your GFR tested. If your numbers are good, you have real data-backed reassurance. If they show something worth addressing, you caught it while you still have meaningful options. Either way, knowing is always better than not knowing. What if my doctor dismisses my concern? You have the right to ask for a GFR test. It is a standard blood test, and it is not an unusual request. If your doctor declines without a clear explanation, ask why. And if you remain concerned after that conversation, a second opinion or a single consultation with a nephrologist is entirely appropriate. Advocating for your own health is not being difficult, it is being responsible. Are supplements kidney safe? Not automatically. High-dose vitamin C has been associated with kidney stress in older adults. Certain herbal products have been linked to serious kidney damage in clinical literature. Excessive protein supplementation over time adds measurable burden to aging kidneys. Supplements belong in that bag you bring to your appointment. All of them. Every time. Let me come back to Margaret one last time. About a year after her kidney function stabilized, she did something that I think is one of the most meaningful things any older adult can do for their own health. She started a notebook, not a medical journal, just a small notebook where she wrote down her GFR each time it was checked, where she kept a running list of every medication and when it was last reviewed, where she wrote down any question that occurred to her before an appointment, so she didn't walk into the office and forget the thing she most needed to ask. She told me, "I spent 32 years making sure other people's children were taken care of. I never applied that same attention to myself." Margaret's daughter started doing the same, and then Margaret's daughter told a friend, "That ripple, that is what informed patients do. They don't just change their own trajectory, they change the conversations happening in the families and friendships around them. Conversations that can reach someone before something goes wrong, not after." You now know the 5 medications that research has documented as potentially harmful to kidneys after 60. You understand why aging kidneys respond differently to combinations that wouldn't have been dangerous at 45. You have 3 specific, actionable solutions to bring to your very next appointment. And you know your GFR, or at the very least, you now know that you need to find it out. My grandmother used to say, "The best time to fix the roof is before the rain." Today, you learned where to look for the leak. Here is what I want you to do right now. If someone's face came to mind during this video, a parent, a sibling, a friend, a neighbor you had coffee with last week, please share this with them. Not to support a channel, because the person you are thinking of right now deserves this information before something goes wrong, not after. And if this video shifted something for you, if it changed how you think about your own health or the health of someone you love, then subscribing is simply how you make sure you don't miss what comes next. Every video on this channel is built around the same question. What do you actually need to know, and how do I say it in a way that genuinely helps you? I'll see you in the next one.